our most esteemed President of the University, Dr. Miriam Pascual, our honored guest and speaker, Ms. Rose B. Pulacar-Pence and her husband Paul, Vice President for Academic Affairs, Dr. Wilma Natividad, Directors and Chiefs of the Directorates of various offices in the University, the various college deans, various college officials, faculty staff, students, and other guests, ladies and gentlemen, good morning. Welcome to the Professional Journey Across Cultures Forum. This is one of the most attended yearly highlights of the MMSU Foundation Anniversary Celebration. This year's theme, Breaking Grounds, Making Strides for Global Recognition, is indicative that the MMSU administration is moving, pushing, and working with utmost dedication and commitment in reaching the Foundation Anniversary Celebrations theme 2 years ago, MMSU as a premier university in Southeast Asia by 2015. Among the strides being undertaken is bringing its faculty outside the four walls of the classrooms. They had been sent for trainings and study tours, attended conferences not only in the Philippines but also in other parts of the world, such as the United States, Europe, and Asian countries. Just recently, the Faculty Exchange Program at the University of Hawaii Maui College became a reality with 4 faculty members, including the VP for Academic Affairs, comprising the first batch of delegations. To gain more from these activities, this professional journey across Cultures Forum had been organized 4 years ago. This forum serves as a venue for participating faculty and non-teaching staff to share knowledge gained, lessons learned, and experiences, as well as feature the places of academic interest they have visited. The audience, on the other hand, learn from their presentations, as well as get a chance to share with some of the blessings and memorabilia as they journeyed across continents. Last year, we visited 3 places. First, we went to Bohol. We explored the best of Bohol with Professor Beatriz Malam as our tour guide. Then we proceeded to China and had a great walk through the malls of China with Ms. Charmaine Balantak as our tour guide. And our last destination is the United States, where we had the thinking, developing, reinventing social change with Professor Dasil. Now this year, we will be traveling to 4 places. First, would be looking at us through UUM Malaysia Truly Asia by Dr. Alegria T. Bisaya. Then we will go to Korea with ICMA 12, the Korean experience, to be presented by Professor Siriaco T. Rakwal. Then we will proceed to the United States. Aloha, Mom is the best, with Mrs. Linda M. Menjula. And then, when we go back to our port of origin, we will drop by Japan to conquer the land of the rising sun by Mrs. Emmy Mirasol. For this year, however, we also have exhibits, as we have officially opened this morning. And truly, a lot of faculty and staff, including students, journeyed this year, and we cannot accommodate all of them in this forum. But this doesn't mean that their journeys mean less to us. in their grandeur exhibits, we can see and learn a lot of things and ideas. Furthermore, Mrs. Pence, our guest speaker, will be here to further enrich this year's journey. Since we have a lot of activities in front of us this morning, may I request the presenters to comply to their 15-minute time allocation. As in previous years, each presenter will be briefly introduced by a moderator whom they specifically selected for this purpose. Presentation follows immediately, and each presenter through the moderator will provide 3 trivia questions for the audience with corresponding fan gifts coming from the country they presented. Once in a while, old photographs from various parts of the world visited by faculty and staff of the university will also be placed in the screen. Guess what? Guess who? And guess where questions will be raised downstage. Fun gifts will likewise be provided. And for the guests who questions, maybe you can claim your prize from the identified person. So what are we waiting for? Open your eyes, clear your ears, and let's start the ball rolling. Again, welcome to the Professional Journey Across Cultures Forum. Good morning.
Thank you very much, Dr. Agustin, Vice President for Research and Extension. And once again, good morning, Mariana Marcos State University, and happy 35th anniversary, foundation anniversary. Good morning, Clyde.
Good morning to Stella. Good morning to everyone in here. So, Stella, what should we expect from this year's Professional Journey Forum?
I know very well that we have seen, or we have caught a glimpse of our exhibit at the back, which actually gives us an idea of what this forum is all about. Today we shall travel around the world through the nostalgic experiences our speakers shall present to us, their stories, their photographs, and of course their words of gratitude, of course, to those people that have been there with them, who shouldered some of their needs perhaps, and of course how they were able to present their papers during this forum that they have been in those countries that they conquered.
Sounds really exciting. So everyone, buckle up, sit back, and enjoy this one-of-a-kind experience. But before anything else, we are also very honored today to have with us a very distinguished guest of honor and speaker. And to introduce our guest, let us all welcome our dear University President, Dr. Miriam E. Pascual.
Our most esteemed guest of honor and speaker, and her better half, Mr. Paul Spence, our provincial administrator, Attorney Wendell Chua, representing our beloved governor, university officials, our exhibitors and resource speakers, members of the faculty and non-teaching staff, beloved parents, students, good morning. Today, on the occasion of the Professional Journey Across Cultures Forum of the 35th University Foundation Anniversary, we have, as guest of honor and speaker, a lovely, brilliant, and talented registered nurse. She holds the degrees Bachelor of Arts in Economics for a first degree and a master's degree in nursing at North Park University in Chicago, Illinois. She migrated to the United States of America in 1994 as a registered nurse and is presently the Vice President of the United Methodist Healthcare Recruitment in Chicago, Illinois, and concurrently the President of Aguinaldo Recruitment Agency in Manila. Yesterday, during the State of the University address, I mentioned that there was an upsurge in various scholarship programs. In addition to the figure I presented, I am very happy to inform you that we have another philanthropist in the person of our guest of honor and speaker, who facilitated the first United Methodist PT scholarship programs for PT interns of MMSU. A big hand. And we deeply acknowledge with gratitude the initial amount she handed in to the university, amounting to $108,000 that will cover partly the internship cost of 18 PT interns. And it is with high hopes that this is just the beginning, because we hope that this will be continued for the coming years. Ladies and gentlemen, it is with distinct honor and privilege to present to you our guest of honor and speaker, Mrs. Rosemary V. Policarpio Spence. Madam.
Maraming salamat po, Madam President. And magandang umaga po sa inyong lahat. Thank you so much. That's it. I would also like to thank the 4 Vice Presidents, our attorney for the Provincial Administrator, Attorney Wendell Chua, and the exhibitors, the faculty and staff, the students, and the family members who are here today. Thank you for coming in. I know that you have to wake up so early in the morning to be able to attend and listen to this presentation today. I am so honored to be here with you today and share some experiences. Actually, I feel so small compared to the experiences of those exhibitors and probably the experiences of the faculty and staff here. But then also, I am very grateful for the invitation. Here with me is Paul Spence to discuss part 1 of my presentation. In fact, I wasn't going to be able to attend today, so I had asked him to present for me because we were waiting for inspection survey in the US. But as soon as we arrived from the airport, I got a call from the US, and they told me that the inspectors, the surveyors are in the building on a Saturday morning. And so that was over. We did very well, and so I was able to extend my stay and stay here and be with you today. Mr. Paul Spence
of course, was born in the U.S. and has a master's degree in business administration and has over 30 years of experience in marketing and sales. In fact, we worked together at some point at United Methodist Homes. He was the vice president for marketing and sales, and then he found a better job and left us. But right now he came back. He is the vice president for marketing for Aguinaldo Recruitment Agency, a subsidiary of the recruitment agency from United Methodist. It's kind of confusing, but here with us is Paul Spence.
Thank you, Rose, my dear. Mein bag bigatyo, Apo. Good morning, everyone, and thank you very much for this opportunity. Very much honored to be here. I've looked forward to this presentation for a long time. And I hope to present to you this morning a topic that is very near and dear to your hearts. And as I pick up the little remote here, let's see if I can get this. Aha. Healthcare jobs in the United States. That's my topic today. I'm going to talk to you about what's happening in the United States in terms of nurses, physical therapists, and also pharmacists. And I have a question that's up on the screen there. What drives the need for nurses, therapists, and pharmacists in the United States? Well, I thought lots about this, and I had some experience, so I came up with 5 areas. And the first area is what I call population dynamics. Of course, there are age groups within the United States that are growing. There are age groups that are declining. And so we need to look at those population dynamics to determine which age groups will need more healthcare services. So I'll go through each of these in detail in just a few minutes. But number 1 is population dynamics. Number 2 are the health facts of Americans. How healthy are we as Americans, or how unhealthy are we as Americans? And that drives the need for healthcare services. Number 3 would be healthcare reimbursements from insurance companies. And you may have heard about this. There's a lot of talk in Washington, D.C. about healthcare insurance. And I will talk about some of the details in just a few minutes. Number 4, associated with insurance is government legislation. Again, lots of talk lately in Washington about what decisions the federal government needs to make in order to provide for the future healthcare needs of its own citizens. And finally, the 5th area that drives the need for healthcare workers in the U.S. is what I call market forces. And simply in economic terms, it's the supply and demand of healthcare workers. So let's look at each of these in detail. And first is USA population. It currently stands at about 315 million people. We add another citizen every 8 seconds in the United States. If we look at the age groups, and there are 3 main age groups that the Bureau of Labor Statistics considers to be important. And those age groups are under 18 years of age, 18 to 64, and 65 plus. And if you look at the two columns there, you'll see the years 2015 and the years 2030, and how each of those age groups either grows or shrinks. Interestingly, the under 18 age group stays the same over those 15 years. But the 18 to 64-year-old group declines by 5 percentage points. And yes, the baby boomers in America, they grow by those 5 percentage points. From 15% of the population coming up in 2015 to over 20% in the year 2030. And in the year 2030, we expect to have 360 million people in the United States. And so 20% of 360 million is 72 million citizens over the age of 65. And it's that group, the over 65-year group, that drives the need for healthcare in the United States. They are the main consumers of healthcare in the U.S., and logically so. And related, I have a couple of fun facts that I came up with related to population. In the U.S., we have those 315 million people. Here in the Philippines, you have 95 million people currently. The United States has 9.6 million square kilometers. And yet the Philippines has 300,000 square kilometers. Our average age in America right now is 45. We're getting older. But in the Philippines, you're a very young country. The average age is only 22. So most of the students in here, you're about average. So if you look at the population and how much land area there is in terms of square kilometers, you get population per square kilometer. And I don't need to tell you that in the U.S., there are fewer people per square kilometer than here in the Philippines. In fact, in the Philippines here, you are 10 times more densely populated than we are in the United States. 320 people per square kilometer. Again, no secret to you. And it's understandable that people would like to emigrate out of the country to find good jobs and send money back to their families here in the Philippines. So those were a couple of fun facts. Okay, back to that list I was talking about in the beginning. Number 2 are the American health facts. How healthy are we as Americans? Well, the 65 plus age group right now, the baby boomers who just reached 65, unfortunately, 24% are in what is considered to be poor health. And that drives the need for all types of healthcare workers: doctors, pharmacists, nurses, therapists, interns. 41% of our seniors are obese. 41%. That number is projected to be 50% in the year 2030. And as you know, obesity leads to diabetes and physiological problems and knee replacements and hip replacements and all types of surgeries. That drives the need for healthcare in the U.S. 67% of people age 65 plus have hypertension. 67%, and that number is expected to climb to over 70% in the year 2030. That drives the need for all types of healthcare workers. 10% use 5 or more prescription drugs. That's a lot. In fact, 40% use 3 or more prescription drugs. So pharmacists, there is a big need for you in the United States. That 65 plus age group is reaching their prime cardiac risk age. And with those risk factors up above there is going to be a need for physical therapists, for doctors, for all types of healthcare workers. So there is a need for you. Again, the 65-year age group, that is by far the largest consumer of healthcare in the United States. So that was number 2 on my list. Number 3 is the U.S. health insurance. Many of you have heard of Medicare. Well, Medicare is primarily a program for those who are 65 years and older. It is paid for by payroll deductions from workers at a rate of 1.45% of our paycheck, every single paycheck. And you have to pay into that program for at least 10 years to get the benefits of Medicare. So, if the economy is in trouble in the United States and there are fewer workers, that means fewer people paying for Medicare. And if there are fewer people paying for Medicare, that's less money available for healthcare workers. So that drives the need for healthcare workers in the U.S. But there's also something called Medicaid, which is a state program. Every state has Medicaid, funded in part by the federal government. There's also local welfare for those who are very low income and cannot afford Medicare or other private insurance. Again, paid for by the states. And right now in the U.S., the states are having problems. My state of Illinois, my home state of Illinois, is probably the #1 state as far as having what they call fiscal problems. They can't seem to figure out a way to pay their bills and pay for health care, especially Medicaid. And so there are talks about cutting back some Medicaid. That affects the need for healthcare workers. There is also private insurance. But private insurance is expensive. And not everyone works. For those who do work, it's a great program. Anyone can purchase it. But again, you've got to pay for it along with your employer. In the United States, typically, the employer pays half of your medical care, and you pay the other half. And there are many different types of programs, so they're all different types of costs. But again, if there are fewer workers in the United States to pay for all of these programs, then the need for healthcare workers is lessened. So that was number 3 as a driver of healthcare. Big topic in Washington is government legislation. Some of you have heard of what's called the fiscal cliff, and that was December 31st. The federal government had to figure out a way to pay its bills. As a country, the United States has been spending way more than it takes in revenue. And revenue, I mean taxes. So for years, since the mid-1990s under President Clinton, the federal government has just spent and spent and spent a lot on military spending, a lot on social programs, but it spent way more than it takes in. So how does the United States conduct deficit reduction? And when it conducts deficit reduction, that affects the need for healthcare workers. Many of you have heard of Obamacare, and it's officially called the Affordable Care Act. In fact, there's a longer name. but it's really the Affordable Care Act, and it means that it's designed to cover all Americans with health care. And I agree with President Obama that all Americans should have some form of health care insurance, because health care in the United States is expensive. And if you don't have health care insurance, it can be very costly. And in fact, there are stories of people who need to sell their homes in order to pay for surgeries and procedures. And that's sad. And so I applaud President Obama in his decision to come up with a program. But that program is very expensive. How do you pay for health care for all Americans and at the same time reduce your overall spending? So in Washington, it's a very interesting time right now. They have to figure out how to reduce spending, raise taxes, and provide health care for everybody. Very difficult to do. And number 5 on my list of drivers of health care need, what I consider to be market forces. And again, those market forces are simply supply and demand. What is the supply of healthcare workers and what is the demand for healthcare workers? So let's look at nursing to start. Right now, American nursing schools, the enrollment has gone up by 5% in 2011 compared to 2010. But in 2011, nursing schools turned away 75,000 applicants. They turned them away. They couldn't take them. There was not enough space. And primarily, there were not enough teachers. You can't teach students if you don't have enough teachers. And the reason there are so few teachers in the U.S., the teachers earn less than the nurses. How can you attract good teachers if being a nurse pays more? It's very difficult, and so there is a push in the United States to find more teachers. Companies like Johnson & Johnson, 3M, and some other countries now have some initiatives to attract good teachers and to pay them fair wages. We need those teachers in the United States. The average age of those teachers, or the average age of RNs in the United States, is about 44 years. And so our teachers are getting older. And what makes that a very significant fact is that as nurses get older, there's new technology that comes in. All of you are learning the new technology in nursing. There are new procedures and new techniques and new equipment. And so nurses who may have been around for several years, they may not know that new technology or that new equipment. And so teachers will then leave the workforce, and we need to replace those teachers with newer students who know all of the latest. Right now, the average turnover in the United States is 14%. That means 14% of the nurses leave the profession, and 14% have to fill those. Here's an interesting fact. I think you'll be interested in this. The median salary right now for nurses in the U.S. is $65,000 U.S. 2.6 million pesos a year. It's a pretty good salary. Now, as far as nurses, there's a lot about immigration, and that's a big driver of need for healthcare workers. I'm going to leave a little bit of that to Rose, who's going to talk a little bit more about immigration. The market forces for physical therapists are a little different. Many of you know that the NPTE exam became much more difficult last year. In fact, it was 1 year ago, I believe this week, or last week, the NPTE exam became very, very difficult. In the United States, only 20% of those who took the exam passed. That includes American schools as well, 20%. That's a very low number, and so that's significant. If not many people are passing the exam, you can't have more people coming into the workforce at a fast rate. The median pay for physical therapists right now, in 2010 actually, was $76,000. 3 million pesos a year. That's a great salary. Entry level is about $50,000 plus, somewhere there. So these are very, very good jobs, and there is a demand for these jobs. As you know, many of our PTs in the United States have doctoral degrees, the DPT. And yes, there is talk of making that a requirement, but Rose will talk about that in a few minutes. Right now, it's about 60% of the therapists have a doctoral degree. There are today about 200,000 physical therapists in the United States, serving all of those seniors. So you can see that there will be a need. They're in PT clinics, they're in senior care centers, and yes, they're in hospitals as well. And what's significant about physical therapists is they actually reduce and avoid costs of future health care. I talked about government legislation. One thing about Obamacare that is very significant is he acknowledges the importance of physical therapy in reducing the risk of cardiac problems and physiotherapy problems, such as knee and hip replacements. So physical therapists are very important to Obama, and if his program passes, we'll need a lot more physical therapists. For pharmacists, in 2010, we had 275,000 pharmacists in the United States. 43% of those were in retail, like Walgreens or Osco Drug in the United States. 23% were in hospitals, and the rest were scattered among clinical positions and pharmaceutical companies in trying to invent new medications. That is a big driver of healthcare in the United States because we need to find new medicines for our baby boomers. Look at that number. The median salary in 2010 for pharmacists was $111,000 US. 4.44 million pesos a year for a pharmacist. Now that's the median salary. Entry level is about 70,000, but still, that is a fantastic, fantastic salary in the US right now. But it does require the PharmD, the doctoral degree, and so that's more expensive and it takes more time to get that degree. And if it takes more time to get the degree, well, there's more demand for good students and good employees. And that drives the need for healthcare workers, for pharmacists. In the US right now, the shortage of pharmacists is over. It's not bad news. It's not bad news. There was a big shortage of pharmacists, and pharmacies were competing like crazy to find new pharmacists. Well, it slowed down. The shortage is now over, and some pharmacists are finding it a little more difficult and more competitive to find jobs. But that's now. Wait till the future. Rose is going to talk about the outlook for these jobs, and you'll see you don't have anything to worry about. And Obama, in his Obamacare, he also stressed the importance of pharmacists. That pharmacists in the future will become much more involved with patient care. They will be stepping out away from the desk behind the pharmacy. They'll be talking with patients more. In fact, they'll be calling patients and interacting much more. So those are my 5 areas that drive the need for healthcare workers. And here to talk about what the outlook is, how many nurses, how many physical therapists, and how many pharmacists we need in the U.S., I'm going to turn it back over to my colleague and wife, Rosie.
Salamat.
Thank you, Paul. Okay, I can figure out how to do this. Okay, what is the future for the nurses, therapists, and pharmacists? What's the outlook? Is there really a shortage or oversupply of nurses? Right now, in the big cities, there's probably oversupply of nurses because hospitals are cutting back. But in the provinces or states that are not very prominent, there is still a shortage of nurses. And like Paul said, the job projection for nurses, it will grow by 25% between 2010 and 2020. Right now, there's 2.7 million nurses employed in hospitals, clinics, and other facilities. It will grow by 700,000 by 2020. So there is still a need. Whether US would recognize it or not, there is a need. With those needs, I believe immigration would speed up. Right now, it's very slow. It would take 6 years for a nurse to be able to get to the US using the immigrant's visa. But with the Obamacare, if it pushed through, and with the need for more nurses, more healthcare, the U.S. government will definitely do something with immigration. Plus, I like this better. The Philippine nurses are better than anybody in the U.S. I'm the director of nursing in our facility. It has 130 beds, and one unit has hip and knee replacement cases only. So after 3 days in the hospital, they will be discharged, and we do the nursing care, therapy, and they stay there for maybe 3 weeks, 4 weeks, and then go back home. Most of the nurses that I assign in our ortho unit are Filipino nurses. Not that I discriminate, but I can sleep at night and know that these residents or these patients are taken care of because the nurses are so competent. And why is that? It's because we have more time to practice. In the US, masyado silang, they're so focused on legal issues. Ididimanda ka pagka nagkamali ka, konting kamali, ididimanda ka. So the nurses there don't really have much experience. Say, for example, inserting IV, inserting Foley catheter. Basic nursing skills are not practiced. Whereas here, magmamakaawa na yung pasyente para ilipat mo yung IV niya kasi namamagana yung kamay niya dito sa kaliwa, kanan. So we a lot of practice when it comes to nursing skills. What's the outlook for physical therapists? It will grow by 39%. Right now, there's 200,000 physical therapy employed in the US, and they would need additional 80,000 physical therapists by 2020. Like Paul said, the average income for physical therapists is around 2 million pesos. So, the need is there. Kung hindi man kayo ma-assign sa mga hospitals, they would still need you in the rural areas. And of course, if there's a demand, the pay will increase. Yung salary nyo, hindi yan bababa, it will increase. But, of course, the expectation would be higher. So, right now, there's a talk of having all the physical therapists to have a degree in, doctorate degree. It's still in the initial process, I guess, but it might come. So those of you who are already PT, do something. If you want to go to the States, mag-take na kayo ng NPTE and go there before they implement this new rule. And for pharmacists, what is the outlook for pharmacists? It will grow by 25%. The total number of pharmacists in the US is 274,000 pharmacists. And if it needs to grow by 25%, they would need around 70,000 pharmacists by 2020. Like Paul said, right now, there is no shortage, but with the demand for healthcare, with the baby boomers and the sick population, it will increase by 70,000 by the year 2020. So, kailangan mag-prepare. And the good thing about that too is the pharmacists will no longer be confined in drug prescription. They will be involved in the education. Right now, dun sa facility namin, yung mga pharmacists, they're the one who's recommending improvements sa mga doctors. Kasi yung doctor, they don't have time anymore to talk or review the medications. Sometimes, each patient has 15 to 20 medication. Sometimes, those are not even necessary. So, the pharmacist would recommend, dear doctor, would you care to review the medication? This is not necessary, or we need to reduce this medication, or this medication interacts with another medication. And they will also be involved in educating the clients or the patients and telling them, you don't really need this. We can cut this. You will not deteriorate if we cut this medication. And plus, with the Obamacare, that's part of that Obamacare is to keep people healthy. Like Paul said, there is an expectation that the physical therapists will be involved in the pre-health of the patient. They will teach them, they will be involved in the teaching para maging healthy ang population ng US, like those obese population. The dietitians will be involved, physical therapists for the exercise, and pharmacists to cut back on unnecessary medication. And of course, for the nurses to be able to do all the nursing education and